I would have come to physically supervise her, but because of the cost of transport and the risk that's involved, we decided to do it this way. All right, so
okay.
Yeah, I would like to speak with you privately first before I will supervise her. I will interview her based on our discussion. All right, so CHIZOBA, you can just excuse us a bit. The reason why I asked her to leave is because I want to know some things from you privately first before interrogating her or before examining her. So first, I want to know when she commenced her IT. When did she start?
Since January. It started January.
Okay, January, okay. All right, has she been regular and punctual?
She has never missed work. She has never missed work for once.
Oh, okay. All right, good to know. Then, can I know the courses you've taught her? Sorry, the tests. Can I know the tests you have taught her so far in your lab?
Okay, you know, the lab, can you hear me?
Yes, I'm hearing you. I'm hearing
you. You know, the lab has different branches.
Okay.
In fact, medical laboratory science in its totality has hematology, microbiology, chemical pathology, and histopathology.
Okay.
So all these things comprise the medical lab science. But here in the lab, all these specialties under medical lab are not covered because of the space. Because the lab is not quite a very big lab.
Okay.
So minus histopathology, every other one, the three others, yes, hematology, microbiology, and the chemical pathology are covered. So now under hematology, she was taught full blood count. Can you hear me?
Yes, full blood count.
She was taught full blood count. And the full blood counts we do here, we have a hematology analyzer, 5 parts. So we don't do manual. Can you hear me?
Yes, I'm hearing you. I'm hearing you.
So the machine does the full blood count for us.
Okay.
That's still under hematology. Then we do ESR, erythrocyte sedimentation rates.
Okay.
Under hematology.
Okay.
We do Kuhn tests and so many other tests that we do under hematology.
Okay.
Then under chemical pathology, we do kidney function tests. Can you hear me?
Yeah, I'm hearing you.
We do kidney function tests, function tests. We do lipid profile tests.
Okay, lipid profile.
Yes, we do uric acid. And you know, before the patient comes here, most times they come from a doctor who must have classed them to know what the problem is and then put down some tests for them. Okay. So that we help the doctor to know what actually is wrong with the patient.
Yeah.
So it depends on the request that the patient has. Of course, coming from the doctor, we now receive the patient and work on the patient sample as the case may be.
I would say I'm very, very grateful for all the good things you've taught her so far. We appreciate it. Thanks for training her very much. Then, yeah, you are supposed to assess her too. So I'll send a form to you through her for you to assess and send the marks back to me.
Okay, when are you doing that, sir?
Today, I'll send it to you through her.
Okay, all right.
Yeah, okay, thank you very much. So let me discuss with her now. I want to interview her. CHIZOBA, how are you?
I'm fine, sir.
Okay, always smiling. So how, I believe you're enjoying your work there. I believe you're enjoying your IT there.
Yes,
All
sir.
right. So I was told you were taught a lot. Can you please tell me the tests you were taught in the lab? The tests that you were taught during your period of industrial training.
I was taught how to test, how to use the hematology analyzer for food blood count test.
Okay.
Giving this HVS, how to use the spectrum to collect HVS sample.
Okay. How to use what? How to use what? How to use
spectrum to collect the spectrum.
Okay, okay, go on.
Sample for yes.
Okay. Go ahead.
Yes, I
Okay.
was taught how to do PSR.
Okay.
As well taught how to record patient tests using their request form. And
okay.
how
Please adjust your camera a bit. The light is reflecting. Adjust your camera a bit. Yeah.
Is it okay?
Yeah, it's better.
And how to record as well.
The last thing you said, I didn't hear you.
I said on how to record results.
Okay, okay.
Like type result and give to it patients.
All right. Okay, I was told you were also taught the MP test, the malaria parasite test.
Yes, I know that.
Okay, that's good to know. Do you know it very well? Do you know how to carry out the MP test?
So far.
All right.
I know what I know.
Okay, that's good to know. All right, so can you explain how the MP test is being carried out? Can you explain how the MP test is being carried out?
You collect blood sample from the patient.
Okay.
And then you smear the blood sample on the slide.
Okay.
And then you air dry.
All right.
Then when it has dry, you stain using a gym stainer to stain it and allow it for 10 minutes.
All right.
After, you can use immersion oil, and then put it on the microscope.
Is it only one stain you use? The stain you use?
Yes.
Is it just one stain? How many times do you stain it?
It's one now.
Okay, all right, go ahead.
Just one.
All right. Okay, go ahead.
And then you put it on the microscope.
All right.
You use the stain to arrange it.
You use what?
The stage clip.
Okay, the stage clip. Okay.
To rotate and put the I think you use the cursor adjustment to rotate the eyepiece to 10 no, it's 100x.
Okay.
So you can
view. All right, so how do you identify have you seen the parasite before?
Yes, I have.
Okay, how does it look?
It has this ring shape.
All right, so that's all for now. So let me see your logbook, please, your logbook. All right. So the first page you wrote description of work done. Okay, what's written on Monday? That's the Monday of that.
Introduction.
Read it.
Introduction, which includes this the staff, the rules and regulation, and its duty days.
Okay, then Friday.
Collection of blood sample.
All right. Like 3 pages and read what's written on Monday and on Friday.
For the next week, I'll start how to collect blood using a syringe, and likewise the Friday of that week, I was lectured on how to use the hematology analyzer for food locant test.
All right, that's good. So now turn to
that one.
Okay, now turn to the last page in that description of work done. Sorry, daily tax report.
Is it this year?
Yeah. Daily tax report. The last one you wrote.
Daily tax reports.
Yeah, that's just still that same area, but the very last thing you did on the Monday of that week.
Semen analyzer.
Semen analyzer or analysis.
Semen analysis, and then will that test typhoid.
Okay, all right. Then description of work done. Let me see what you wrote on the page for description of work done. All right, what's there? What's there? Which
is EXR?
Huh?
EXR.
What's ESR? What do you mean of ESR? Pardon?
Electrocyte segmentation rate.
Okay. All right, the next page. What's on the next page?
Sample bottles. Sample bottles.
All right, okay. All right. Did you fill all the pages?
Yes.
Okay. All right, thank you very much. So when you return, you'll bring the logbook for me to sign. Since it's online supervision, I'm unable to sign for you. All right, so when you return, you bring it for me to sign. That's good. Your logbook is properly filled. Then I'll send a document to you that you print out and give to industry-based supervisor. He will assess you and send it back to me through WhatsApp. He will assess you and snap it and send it to me through WhatsApp. All right,
print it and give it.
Or you can send it to him, then he will print and then use it to assess you and send back to me.
Okay.
All right. Okay, now take care.
All right.
Yeah.